This is Dr. Caudill Miller with Dr. Miller's Guide to Neurology. We're talking about headaches again today. Today we're going to talk about Botox. You know, when you bring up Botox, people cringe. They think about cosmetic Botox, but we were using Botox for 20 to 30 years for dystonias before we started using it for headaches. And I will say that when it came out for headaches, I was not a big believer until I started using it. In fact, I would have been very happy if 1 to 3 out of 10 of my chronic headache patients that had failed everything else, all these other things we've just talked about, if 1 to 3 out of 10 would have worked. It's just been remarkable. I can't say 10 out of 10, but it's very close. If patient selection is correct, it just works great. Several criteria: you have to have 15 migraines a month, and you have to record this for 3 months. So you have to have 15 migraines a month for 3 straight months. Another thing is you need to really have this done by somebody who's doing it correctly. We can't just be sporadic. There are 31 different injection sites, 100 to 155 units. Some people, rather than just wasting the other 45 that's in the bottle, give the full 200, which is totally safe. You know, the maximal dose of Botox that you should take at any one time is 300 units, and we use that a good bit with dystonia. Essentially, we start with 3 little injections right here in the center, 2 above the eye. But once again, remember, we don't want to inject right over the orbicularis oculi because it'll cause the eyes to close. About 4 in each temple, and then down the back of the head into the trapezius, 31 different injections. Does not take very long. We use a small TB skin test. Now, I tell people to come into the office with a little cooler and put ice on it while they're waiting for me to do the Botox. It works so much better. And then as soon as I finish, ice it for 15 or 20 minutes minimum. It keeps the medicine from diffusing away. And then remember, Botox won't work for 2 weeks. So we had a really funny old country boy call one of my nurses 5 days after. "Tell Dr. Miller this darn stuff ain't working." And she said, "Oh, he told you this. It takes 2 weeks to kick in." It takes 2 weeks to kick in. And it lasts, 3 to 9 months. The vast majority of the time it runs out in 10 to 12 weeks. So we generally will do Botox for headaches every 12 weeks, which is all the insurance company will pay. Now, if you failed all of these medications, you need to fight to get Botox. You can get it done. Pre-surting is difficult because it is expensive, but in a specialized headache clinic, you can get it done. So if you want Botox, you need to fight your insurance company because it just works great. So comment on my video, like it, subscribe, and we will talk again soon.